If you have been told that poor leg circulation is just part of getting older, or that one trendy drink can clear it up by tomorrow morning, I want you to pause right here, because both of those ideas can quietly cost seniors precious time. I am Dr. Alina Serratia, and over the years I have heard every version of this myth ladder. A neighbor says cold feet are harmless. A friend swears by ginger water. Social media promises that one purple juice will clean your arteries. And meanwhile, the reaper at one trout. Warning, Sauber one stone. Sao sei chi ein chi dismissed. So in the next few minutes, I want to help you separate fiction from fact, walk you through a simple 30-second check you can do at home, and show you 3 drinks that may support healthier blood flow faster than most people expect. Not by magic, but by physiology. Before we go any further, tell me in the comments if you have ever heard one of these phrases. It's just aging. You need better socks. Or, drink this and your circulation will be fixed. I read those comments carefully because they tell me which myths are doing the most damage. And stay with me, because the third drink is not the one most channels keep shouting about. In my view, it may be the most practical one for many seniors. The first myth is simple, and it is everywhere. Cold feet, leg heaviness, and nighttime cramps are normal after 60. I understand why people believe that. Aging does change blood vessels, muscle mass, nerve sensitivity, and daily activity. But normal aging does not mean you should ignore signs that your legs are asking for help. Mayo Clinic lists coldness in one lower leg or foot, pain when walking, numbness, weakness, slow healing sores, and color changes among the symptoms that can happen when blood flow is reduced in the legs. The National Heart, Lung, and Blood Institute says more than 8 million Americans age 40 and older have peripheral artery disease, and many people have few symptoms or mistake them for something else. That is what makes this so tricky. The problem often whispers before it shouts. A woman I will call Denise, age 72, told me she thought her cold toes were just bad circulation in the vague, harmless sense. Then she noticed something else. By evening, her legs felt heavy. Not dramatic pain, just an odd, dragging feeling. Later came calf tightness when she walked farther than usual. She did what many people do. She bought thicker socks, rubbed cream on her legs, and kept telling herself it was nothing. What most people miss is that the body often gives small signals long before it gives a crisis. So here is the truth. Not every cold foot means blocked arteries. Room temperature, thyroid problems, anemia, nerve issues, some medications, and low body weight can play a role. But if cold feet keep showing up with walking pain, numbness, skin color changes, weak pulses, slow healing cuts, or one foot that feels colder than the other, that deserves attention, especially after 65. Especially if you have diabetes, high blood pressure, high cholesterol, kidney disease, or a smoking history. If that is you, please do not brush it off, because a friend told you it is just age. Now let me give you the quick home check I promised. This is not a diagnosis, and it does not replace an ankle brachial index or a medical exam, but it can be a useful clue. Sit down somewhere warm. Take off your shoe and sock. Press gently on the nail bed of your big toe until it turns pale. Hold for about 5 seconds, then let go. Count how long it takes for the pink color to return. Do that on both big toes. In general, capillary refill in adults is considered normal if color returns in under 3 seconds. But age, room temperature, nail polish, skin tone, and even lighting can affect the result. If refill seems delayed, especially if one foot is slower than the other, or your toe stays pale, bluish, or unusually cold, that is not a reason to panic. It is a reason to pay attention and bring it up with your clinician. If you tried that with me, write "done" in the comments. And if one side looked slower, write "left" or "right." You would be surprised how often comparison tells the story. The overlooked part is not the exact number alone. It is the pattern. Slow refill plus symptoms matters far more than a single home test by itself. Now we climb to myth number 2. If I can still walk around my house, my circulation must be fine. I wish that were true. Many seniors think serious circulation trouble means dramatic pain, but early trouble is often subtle. You may only notice symptoms when your muscles ask for more oxygen, like on stairs, during a longer grocery trip, or after a few blocks. Then, when you rest, the discomfort fades. That pattern matters. It can happen when narrowed arteries cannot keep up with demand. Mayo Clinic describes exactly that kind of exercise-related leg pain, called claudication. And the 2024 PAD guideline reminds us that older adults with PAD can lose mobility faster and face much more function-limiting pain than people without it. I remember a man named Carl, 78, who told me, "Doctor, I walk every day from the kitchen to the mailbox, so I know my circulation is okay." Then I asked one follow-up question. "What happens if you keep going?" He laughed and said, "Then my calves start arguing with me." That one sentence told me more than his confidence did. Many people judge circulation by whether they can move at all. The better question is whether they can move without predictable heaviness, cramping, burning, or weakness. This is where many seniors get caught off guard. Walking is excellent. I want you walking if your doctor says it is safe. But walking alone is not a perfect screening tool, and it does not erase risk from diabetes, smoking, high blood pressure, or plaque buildup. If you notice calf pain that shows up with effort and settles with rest, or wounds on the feet that heal slowly, or one leg that seems colder or weaker, please get that checked. And if you ever have sudden severe leg pain, a pale or blue foot, sudden numbness, or loss of movement, that can be urgent. There is another belief I want to challenge before we get to the drinks. Many seniors assume that if there is no dramatic pain, there is no real circulation issue. That is not how the body always works. Some people with reduced leg blood flow feel cramping. Others mostly notice fatigue, slower walking, shiny skin, slower toenail growth, or feet that seem to take forever to warm up in bed. NHLBI notes that only about 1 in 4 people with PAD has the classic exercise pain pattern. That means a large number of people either have different symptoms or none that they recognize clearly. This is why the phrase, "I'm uncomfortable, but not hurting," should still make you curious. I had a patient I will call Miriam, age 69, who kept saying, "It doesn't really hurt, so I'm not worried." But then she described planning her errands around where she could sit down. She was not avoiding pain. She was avoiding demand. Her legs had quietly trained her to do less, and she thought that was normal. That's when things begin to shift in the wrong direction. Muscles get less active, calf pumping gets weaker, walking range shrinks, and the very system that needs support gets even less of it. If that sounds familiar, please hear this with compassion, not blame. The body adapts long before we label the problem. So if you have been moving less because your legs feel unreliable, heavy, tight, or strangely tired, that counts. It counts even if you never use the word pain. And if you know someone over 70 who keeps saying, "I'm fine, I just don't go far anymore," share this video with them. Sometimes the biggest myth is not the loud one online. It is the quiet sentence people repeat to themselves in the kitchen every day. And one more clue. If you start choosing the elevator, parking closer, or skipping church aisles, garden rows, or family outings because your legs tire out sooner, that is useful information, not weakness. Your habits can reveal circulation stress before your words do, before symptoms feel obvious. Now let us tackle the myth that fuels most of these videos. One special drink can unclog leg arteries fast. No, not responsibly, no. No drink clears plaque overnight. No tea, juice, tonic, spice shot, or so-called natural blood thinner should be sold to you as a substitute for medical care. If someone says a kitchen remedy can replace evaluation for leg pain, ulcers, or suspected PAD, I want you to be skeptical immediately. But here is the truth that keeps people interested for good reason. Some drinks can support circulation fairly quickly in more modest and believable ways. They can improve hydration, support nitric oxide production, help blood vessels relax, or slightly improve blood pressure and vascular function. That does not mean cure. It means support. That distinction matters. The first drink is the least glamorous, and for some viewers, it is the one that works fastest. Plain water. I know that sounds almost too simple for YouTube, but dehydration is one of the easiest circulation stressors to underestimate in older adults. A 2023 review on hydration in older adults explained that seniors are more vulnerable to dehydration because thirst signals become blunted, kidneys concentrate urine less effectively, mobility can be limited, and some people restrict fluids because they fear incontinence. Another geriatric study found that hydration status changed proteins related to coagulation and wound healing in older patients. Translation in plain English. When the body is low on fluid, blood flow dynamics and healing chemistry can shift in the wrong direction. Here is what your body starts doing when you are a little dried out. Blood volume drops. The heart has less fluid to work with. Blood can become more concentrated. Tissues at the far end of the system, especially toes and feet, may feel it first. Many seniors wake up already behind because they have not had fluids for hours overnight. That is one reason morning leg, heaviness, dizziness, or that wooden feeling in the calves can sneak up on people. So how do you use water wisely? I like a simple start. Drink a glass of water within the first hour after waking, unless your clinician has you on fluid restriction for heart failure, kidney disease, or another condition. Then spread fluids through the first half of the day instead of trying to catch up at night. You do not need to flood yourself. You need consistency. If your mouth is dry, your urine is dark, you feel more fatigued than usual, or you get lightheaded when standing, dehydration may be part of the picture. If you are on diuretics, ask your clinician how much fluid is right for you. Do not guess. If that surprised you, type water first below, because this is the myth that fools a lot of people. They chase exotic drinks while ignoring the simplest one. The second drink is beetroot juice, and this is where the science gets more interesting. Beetroot contains dietary nitrate. Your body can convert that nitrate into nitric oxide, a molecule that helps blood vessels relax and widen. That can support better blood flow. In a 2021 randomized clinical trial in people with peripheral artery disease, a moderate dose of dietary nitrate from beetroot juice improved endothelial function and walking capacity. Endothelial function means how well the inner lining of your blood vessels responds. In 2024, a small double-blind crossover study in 11 patients with PAD did not show a significant boost in walking time, but it did show lower peak exercise diastolic blood pressure and a trend toward better blood flow response. So the evidence is encouraging, but not perfect. That mixed picture is exactly why I trust it more than miracle talk. Real science is often promising before it is dramatic. Many clinicians have observed that some patients feel warmer feet or easier walking within hours to days of nitrate-rich foods, but that does not happen for everyone, and it does not mean disease is gone. If you want to try beetroot juice, keep it simple. A small serving, often around half a cup to 1 cup, can be enough for many people. Choose unsweetened if possible. Some people prefer blending cooked beet with water and a squeeze of lemon rather than buying sugary bottled versions. Who should be cautious? Anyone with diabetes needs to watch sugar content. Anyone prone to kidney stones should ask about oxalates. If you have kidney disease or follow a potassium restriction, check first. Beetroot can also turn urine or stool pink or red, which can startle people if they do not expect it. That color change is usually harmless, but I always warn patients so they do not panic. The third drink is the one many viewers do not expect me to choose: unsweetened cocoa, or a low-sugar cocoa drink, rich in flavonols. Most people think of cocoa as dessert, not circulation support, but a 6-month randomized clinical trial in 44 adults with PAD, average age about 72, found that a cocoa beverage improved 6-minute walk distance compared with placebo and showed favorable changes in calf muscle capillary density and mitochondrial activity. That does not mean hot chocolate from a packet full of sugar. It means cocoa flavonols, the plant compounds in real cocoa, may support blood vessel function and muscle performance over time. What few people realize is that the fast part here may not mean overnight symptom reversal. It may mean that blood vessels respond to cocoa flavonols within hours, while walking improvements build over weeks and months. That is still exciting because it gives us a realistic timeline. If you want to try it, look for unsweetened cocoa powder mixed into warm milk or an unsweetened milk alternative. Keep added sugar low. If you are sensitive to caffeine, take note that cocoa has a little. And if you have reflux, evening cocoa may not be your friend. You may be wondering why I did not put green tea in my top 3 today. I like green tea in many situations, and a meta-analysis of 55 trials found modest benefits for diastolic blood pressure and some cardiometabolic markers. But a small trial in older adults did not show a significant improvement in flow-mediated dilation, which is a common test of endothelial function. So green tea remains a maybe, not a frontrunner, for this exact video. I would rather give you a more honest top 3 than a trendier one. Now let us step onto another rung of the myth ladder. If a drink supports circulation, I do not need to change anything else. This is the trap. Drinks work best as part of a pattern. Imagine trying to water a garden with the hose kinked, the soil packed, and the sun blazing. The water matters, but so does the whole setup. Circulation works the same way. Here's a simple real-life stack I often discuss with older adults. Start the day with water. Later in the morning or early afternoon, if it fits your health situation, use beetroot juice on selected days. Use unsweetened cocoa as a regular support drink, not a sugar bomb. Then combine those choices with 2 non-negotiable habits. Move your ankles and calves often and stop sitting for long stretches without a break. The calf muscles act like a second pump for blood returning from the lower legs. If you sit still for an hour, you lose that support. Even a short round of ankle pumps, heel raises, or a 1-minute walk through the house can help restart the rhythm. Let me tell you about Rose, who is 80. She did not need a dramatic overhaul. She needed a believable routine. She started drinking water earlier in the day instead of waiting until dinner. She used a small beet drink 3 afternoons a week. She switched her sweet evening cocoa to a low-sugar version. Most important, every time a television commercial came on, she did seated ankle pumps. Within 2 weeks, the first change she noticed was not miracle warmth. It was less evening heaviness. Then she realized she was dreading stairs a little less. That is how progress often looks in real life. Not fireworks. Fewer frictions. Before I give my safety cautions, tell me which myth fooled you most. Was it, this is just aging, I can still walk so I must be fine, 1 drink can fix it, or I don't need anything except the drink? Put the myth number or write the phrase. Your answer may help someone else recognize their own pattern. Now the cautions, because this part matters. If you have diabetes, kidney disease, heart failure, uncontrolled high blood pressure, or you take blood thinners, diuretics, nitrates, or multiple blood pressure medications, talk with your healthcare professional before making big changes in fluids or adding concentrated drinks regularly. Do not stop prescribed treatment because you felt better for 2 days. Do not use home drinks to cover up rest pain, foot wounds, or worsening walking pain. And please do not ignore ulcers, blackened toes, sudden color changes, or new numbness. Also remember that poor circulation is not always arterial. Some people have vein problems, swelling from heart or kidney issues, nerve problems, spinal stenosis, medication effects, or simple inactivity layered on top. That is why responsible advice has to stay humble. A useful home step is still just a step. So let me bring this home clearly. The first myth is that leg circulation problems are always just aging. They are not. The second myth is that being able to walk a little means your blood flow is fine. It does not. The third myth is that one magic drink unclogs arteries fast. Absolutely not. The truth is more grounded and more hopeful. A quick toe refill check can give you a clue. Better hydration can help some people quickly. Beetroot juice may support nitric oxide and vessel relaxation. Unsweetened cocoa may support vascular and walking function over time. And these tools work best when you pair them with movement, awareness, and proper medical follow-up. If this video gave you a clearer picture, subscribe because I make these videos for seniors who are tired of hype and want practical health guidance they can actually use. And in the comments, tell me which of the 3 drinks you would realistically try first: water, beetroot, or cocoa. In the next video, I want to show you the seated leg movements I use most often to help older adults support circulation without needing a gym, fancy equipment, or a perfect balance day.